Hi everyone, in honor of World MS Day, I've created a video on multiple sclerosis and I'm going to teach you about what MS is and how we can support those living with the condition. Thanks for watching. So to begin, what is multiple sclerosis? So multiple sclerosis, which we will refer to as MS throughout the rest of this presentation, is an autoimmune disorder where the body's immune system attacks its own tissues, specifically the myelin sheath that surrounds our nerve fibers. And what this leads to is varied neurological symptoms due to disrupted nerve communication. MS also affects the central nervous system, which is comprised of the brain, the spinal cord, and optic nerves, and it is this CNS, the central nervous system, that's targeted by the immune response. So when demyelination and scarring occurs, the myelin sheath is damaged, which leads to slow and disrupted nerve signals and the formation of scars and lesions. Again, varied symptoms can occur, so depending on the affected areas, symptoms can include vision problems, numbness, tingling, weakness, and cognitive or coordination issues. And some individuals can be in a wheelchair or have to use other assistive devices due to these symptoms. There are multiple causes and risk factors of MS, so the first being genetic factors, and there are specific gene variations that increase one's susceptibility to MS. Environmental triggers are another risk factor or cause, and exposure to certain viruses, as well as low vitamin D levels and smoking, can contribute immune system dysregulation. To elaborate on viral infections, the Epstein-Barr virus and other viral infections have been linked to an increased risk of developing MS. Geographic location has also been identified as a risk factor to MS, as higher prevalence in regions farther from the equator suggest a potential link to sunlight exposure and vitamin D levels and MS. And then sex/gender. So women are actually 2 to 3 times more likely to develop MS compared to men. And age is another risk factor. So it is most commonly diagnosed between the ages of 20 and 40 years old. Now, when we look a little more in depth at the symptoms and the diagnosis process of MS, common symptoms include, again, vision problems. So it can cause optic neuritis, which is a condition where inflammation damages the optic nerve and leads to blurred vision, loss of color vision, or temporary blindness in one eye. Fatigue is another common symptom, and it's one of the most common symptoms. And it's often described as an overwhelming sense of exhaustion even after sufficient rest. So it can significantly impact daily activities and one's quality of life. Numbness and tingling are other very common symptoms. It can cause a pins and needles sensation in various parts of the body, such as the limbs, trunk, or face, due to damage to the myelin sheath surrounding the nerves. And the primary test that is used to diagnose MS is the MRI scans. So they are crucial as a diagnostic tool for this disease, as they can detect lesions or areas of inflammation and demyelination in the brain and spinal cord, which helps to confirm the diagnosis and monitor the progression of the disease. When we're determining how to treat the symptoms of MS, there are a few strategies. So you cannot cure MS, however, there are ways to manage living with the disease. So there are disease-modifying therapies, such as injectable medications that slow the progression of MS. There are also symptom management drugs, so medications for managing specific symptoms like muscle spasms or bladder control. Physical therapy is another great option, so exercises and techniques are used to improve mobility, strength, and flexibility. Occupational therapists are often connected with individuals living with MS, as they can help connect them with assistive devices and strategies that can support them to manage their daily activities. Diet and nutrition, of course, is always very important, and a balanced diet rich in anti-inflammatory foods may help to manage symptoms. And finally, stress management. So techniques like meditation and yoga can be used to reduce stress and improve overall well-being. Now, when it comes to living with MS, there are different supports and resources that can be accessed to help your quality of life and improve your management of the disease. A lot of these were previously mentioned, but to go into more detail, we have support groups, which you can join a local or online support group, which can provide a sense of community, emotional support, and practical advice from others that face similar challenges with MS. Self-care practices are also very important, so this ties in with stress management. So engaging in stress-reducing activities like meditation, yoga, or practicing mindfulness can help manage symptoms and improve overall well-being. Again, by connecting with occupational therapists, we can have adaptive aids and home modifications set up. So there can be assistive devices like canes, walkers, or wheelchairs, and home modifications like grab bars or ramps that can help to maintain your independence and safety. Other lifestyle adjustments, just like we had previously mentioned, include dietary changes and incorporating low-impact exercises into daily routines to help manage fatigue as well and maintain a healthy hormone balance. Open communication is also extremely crucial, so having a good connection, whether it be with a friend, family member, a physician, or whoever you feel comfortable with, is crucial, as you can communicate your needs and challenges and facilitate understanding with one another to provide each other support appropriately. Emotional well-being ties into the open communication piece, so seeking counseling or therapy can also be a great option to address the emotional challenges of living with a chronic condition like MS as well. So whether it be seeking counseling through a therapist, or again, finding someone that you feel very comfortable with, whether it's a friend, family member, and making sure that you're maintaining the open communication with them. There's a few different resources and organizations that advocate for those living with MS, and you can visit their websites to receive more information on the disease and different supports available. One of these resources is the National Multiple Sclerosis Society. Another is the Multiple Sclerosis Association of America. There's also the Multiple Sclerosis Foundation and the Multiple Sclerosis Society of Canada. So again, visiting these websites can bring a lot of educational resources to your fingertips to learn more about the disease and what's available to improve your quality of life. When we look at myths and misconceptions of MS, there are a few interesting ones here. So I will go through each of the three. So 35% of people believe that MS is a terminal illness and it's something that can kill you, when that is actually not true. It can be debilitating, but with the right supports that we previously mentioned, you can manage the disease and actually have a good quality of life with the disease. It's just a matter of getting connected with those supports and resources. 45% of people also believe that MS only affects mobility, which again, after learning about MS through this presentation, we know is not true. And then 60% of people were found to believe that MS has a single identifiable cause, which again is not true, because there can be a combination of factors that contributes to one's development of multiple sclerosis. Finally, some positive notes about the future of multiple sclerosis care. There's a potential cure rate with stem cell therapy that is being researched at this moment. So a lot of scientists are looking into stem cell therapy and how this can improve the neural connection that is impaired with people with MS. There's also an expected increase in remyelination treatments. So instead of the myelin sheath of nerve fibers being damaged, these therapies actually improve and fix these myelin sheaths. And with these advances in research and technologies and treatments, there's an anticipated improvement in the quality of life of those living with MS. Thank you.